But you don't look gay. Oh, I'm sorry. Hold on, let me just...
This is so real. Postpartum hair loss is so common. I see it all the time as a derm and personally have experienced it as a mom. Let me give you some tips on how to get through it. Postpartum hair loss is a form of telogen effluvium. This is the type of hair shedding that we see after a significant event occurs in your life, a big stressor. In the case of being postpartum, you have a huge dip in hormones, and that's going to definitely set off a signal to shed hair. And the other thing too, giving birth itself is a traumatic and stressful event in many people, and the stress from that will also set off as telogen effluvium. So what happens is that your hair will shed 3 to 4 months after this stressful event. It can be dramatic, but it's temporary. Most people will see improvement in 6 to 12 months. Okay, so ways to deal with it. Obviously, good nutrition is important. Having enough iron, vitamin D, B vitamins. You also want to consider using topical products. If you're not breastfeeding, you can certainly use topical minoxidil. It's a little bit more of a gray area. If you are breastfeeding, I would say to stay on the safe side. You could use a variety of different hair serums that have different botanicals, caffeine, peptides. I'm also a big fan of red light therapy, the hats and caps that have that. And I know easier said than done. You're a mom, sleep and stress just kind of come with the territory, but finding ways to mitigate that will be huge. Remember, you're not losing your hair. You're just going through a wild hormonal ride. So let me know how I can support you.